So finally, let's look at PEth. This is quite new, and it is for alcohol. And we just want to see if it was something that you might want to consider in the community. Now, PEth, phosphatidylethanol, is only produced when alcohol is consumed, so it's a very, very good marker. It's collected from a fingerprick blood spot sample, so it can be collected by anyone. It's dead easy to collect, and it can give you quite a long history, so up to about 4 weeks overview of alcohol consumption. Now, it is lab analysis, so that's one of the cons, but the benefits are quite good. It's very specific, so PEth is not affected by anything else, like some of the blood markers are. You know, CDT test, liver function test, things like that. They could be misleading. PEth isn't. It's very specific. The sensitivity is brilliant with PEth because it's lab analysis. You're up into the very, very high 99% plus of sensitivity. So it's a good way to differentiate between abstinence, social drinking, and chronic excessive use, binge drinking, things like that. It's not invasive, collected via blood spot, so it's easy to collect. You don't need phlebotomy to collect it. And it can detect a single heavy drinking episode. So if you're looking for someone that does binge drink over the weekend, you know, within the last 12 days, for instance, then it's a great way of finding that out. And it's a very stable product to send back to the lab as well. So there are some issues with it. It's only a snapshot. It's not a history. It only looks back over a month. So again, it doesn't give you the longer window like Herstron testing would. PEth identifies levels of drinking, but it can't tell you exactly how many drinks were consumed. So if that's something specific you want to know, then it's not really that straightforward for that. Nor are most of the products that you would use really. Doesn't really give you an exact idea of how much the person has consumed. And it's not really real time. So because it's lab analysis, you'd wait 3 to 5 days as a result. And it's not really like a breathalyzer, whereby is it in your system at the moment? Is it in your lungs? Is it in your blood? You know, so there are limitations in that respect. And it is more expensive because it's lab analysis. You're probably looking at around £150 per test with your lab fees. But it can be an option to help support what you're doing with the breathalyzers or the scram bracelets. You know, again, it's a bit of a belt and braces approach to all of this.